Hi, welcome. It is part 2 of today's campaign update, and this is my State of the Union part of it. I am Susan Maud Buchser-Lochocki, a presidential candidate from the 2020, 2024, and 2028 presidential election, and I should say for the 2028 presidential election. Welcome. This is the State of the Union part, and it is my sort of State of the Union right around the Martin Luther King Jr. Day holiday. And first, I want to say I hope everyone had a good long weekend and enjoyed their celebrating of this special day and a very special U.S. citizen. Martin Luther King Jr., technically he was a doctor many times over and a reverend, and really somebody who stood his ground and stood his belief he had integrity. And he is somebody to be admired, for sure. So we can all do a lot for our own selves if we emulate some of the things that he did and lived with integrity. So, anyways, the short way of saying it is King Day, so happy King Day. Then the Union. The Union is failing a lot. We have too much, in my opinion, bald, narcissistic capitalism. And our government forgot that monopolies are not part of our capitalist view in the USA. So we are not fans of monopolies. And we've got lots of monopolies and conglomerates that are just too big, and they're not treating their workers well. So the citizens are suffering. And it's up to the government to work with the citizens to make sure that they get what they need. At least that's how I see government. We're here to help the citizens, not necessarily the corporations. So let me repeat that. In my USA, we are for the people, and we're by the people. We are not for the Democrats and Republicans. We are not for the lobbyists. And we're not by the Democrats and Republicans, although, I mean, technically right now we are, but that's actually unconstitutional what they've done, keeping other parties out. But that's a whole different story. But we are people. It's what our Constitution says. We the people. It doesn't say we the lobbyists. It doesn't say we the monopolies out there. It doesn't say we the Democrats and Republicans. It says we the people. So the people are my main goal. And the people being able to reach their goals and live their lives to the fullest. That's my USA. And so our current system, which is very greed-oriented, it's got to stop. And now Trump has already taken steps moving it in that direction. So that's good. But we got to go further. And so my concept is friendly capitalism. I don't want to lose capitalism completely because it motivates some people. It doesn't motivate all. but it does motivate some. But what we have to do is, we have to raise our standard. Right now, we have a very low baseline U.S. standard of living. And we need to bring everybody up a couple of notches. And then I'll be happy. So, what that means is healthcare. We got the medical industry taking advantage of us and selling us lies right and left. I mean, it starts from when they get their diplomas. Apparently, the oath that they take, so it's no longer required. So I would like to make that a requirement again. And I'd like to make it a requirement every year that they make a video of them doing it in an official way, going to a judge and making it official. And then they need to post that video on their page wherever they're doing their doctor work. And maybe have it available also in their office for any walk-ins. Because if doctors don't have the patient's best interest in mind, then they're out for greed. And this is unacceptable. And this is sadly what we have right now, because apparently a lot of the universities and colleges do that oath, if they do it at all. Some of them don't do it. So then the doctors never say it. So then they're not obligated to put humans first and be ethical in their medical treatments. So that's the first problem. Then we have colleges and universities that do it, but they do it at the graduation ceremony, and they don't do it individually. They do it as a group. So if there's 200 or 1,000 people graduating, they all say it at the same time. And whether they mean it or not is a different story. And then if there's somebody who's sick that day, then they never said it also. But they all get their diplomas anyways. So it should be you have to say it in front of a judge. Then you get a note that says that you said it, and then you can get your diploma. You should not be able to get it before you give the Hippocratic Oath and promise to put humanity first and your profits second. There's a reason why they had that oath. And we see it on a daily basis with all the botched jobs, botched operations, missed, just screwed up operations, and the patient is left maimed or disabled, or they didn't get the procedure they wanted, or the doctor lied to them and the procedure ends up looking someplace else. I mean, this is from plastic surgery too, to also killing the patients. And this is just unacceptable. I know that organ donating is very profitable. So, sometimes there are bad actors, even in the medical industry, who are out to hurt you so that they can get your organs. So this is unacceptable. Unacceptable. And not in my USA. Doctors don't have a right to earn so much money on top of what other people earn around them. So we need to overhaul the medical industry in the USA completely. And that includes drug companies too. We have all the same resources right here in our own USA as they do in Africa, as they do in South America, as they do in Europe and Asia. So we actually technically have no reason to cross borders to get any drugs, because we have all the things that we need right here. We can make the same drugs and give them to our people without tariffs without a middleman or anything like that. And we also will know then we're making medicine for U.S. citizens. And so we want to make it good quality. We don't want it cheap. And this is the other problem. We do have people who are making medicines and drugs here, and they're doing it also to harm people. So we do have to get this element of anger and hate out of our country. It's un-USA to be hateful, and we need to stop that. The us versus them needs to stop. So with all of that said, we need to make healthcare more local and simple. We need to make health insurance also more local, centralized in a town, in a county, and it needs to work as a community where the community can keep their eye on things and make sure ethics are being done. And it's gotten too big, too out of control, and too profit-oriented, where the citizen is not, the sick person is not the priority. We're treating symptoms and not fixing the problem, the root problem. So we need to work more on healthy citizens first, and then treat the healthy citizen to get back to being healthy, not just to fix their symptoms and make a profit off of it, which is exactly what we've got right now. So, curing people by hiding and cloaking their symptoms is not curing them. That's just hiding and cloaking their symptoms so that you can get paid lots of money because they have to come in and have all these tests done constantly. And this is just, it's outright disgusting. It's disgusting. The state of our medical industry is greed. And it's not about the U.S. citizen. It's about greed. And it's got to stop. From drugs to procedures, hospitals, and even local clinics and everything. It's just, we got to move to a community-based system, centralized, where everyone gets care. We can still have private whatevers. There can still be private doctors and private this and that. But we need some general, simple, basic healthcare for you and me, for all of us. Just in our town, a local doctor, local pharmacy, local care, and that way we can really become a community again. We've lost that. Or maybe we never had it. But I've witnessed it in other places, and it works. It's not also perfect, but it's better than what we've got right now. And that's, if we put the U.S. way on it, it could be then perfect. So this is where we're heading, folks. We got to work on healthcare. Now, Trump put out a healthcare plan, but he's just putting more bandages on a system that's broken. So we need to bring insurance companies also local. Every town gets a little potty where everybody donates at the beginning of the year to the kitty, and then if we need the money, if somebody gets into a huge accident, or if cancer treatment is needed or something like that, then you have the insurance money there. But to join into an insurance that is in multiple states or even statewide, countrywide, where the CEO is getting millions of dollars as a bonus, that's just obscene. That's like the easiest job ever. Sign me up. I'll be the next CEO of XYZ insurance company and just sit there and count my money at the end of the year. I mean, that's just a ridiculous job. Talk about pyramid scheme. So let's move healthcare more locally, and then if you really have something major, then you go to the bigger city, but then you can still use the money from your local town or county for your medical treatment. So this is my healthcare plan, bringing it more local. Everything in my plan is bringing things local, giving the people, the jobs, the opportunities, so you can make your own educated decision on what you want to do. And and that will create a lot of jobs too, right in the neighborhood. So you don't even have to go far. And then I want to also turn school buses, as you know, into town buses. So then you even have a way to get to work with your school bus, and you don't have to drive. So we do have a jobs issue coming up that's going to be pretty crazy soon here in the USA and actually all over the world, because we have robots coming soon. And robots will be good at certain jobs, but we still are going to want people to be doing things. So that's why also bringing jobs locally is the best way to do that, to give people actual work. Because we still want to work, but work will be changing in the next 5 years, how it looks. So be prepared. And you know that I have plans for the school system. I'll talk about that maybe next week or so. But I really wanted to talk about healthcare because Trump did put out a new concept of healthcare, but it doesn't go at all far enough. It's just more Band-Aids. It's not useful. It's a waste of breath, actually. And we need change, big change. And it's time, many people go to school for a long time, and many people go to expensive schools. So using that as a reason to be able to charge so much for work when you're just a doctor, I'm sorry. No, that's no longer an excuse. You get a salary that's a normal one. You don't get to charge XYZ amount of money for your procedures. Not in my book, anyways. Not in my USA. No. The people, we've had it. We want affordable health care. And that's how you do it. So, on that note, I'm going to end this part 2 of my campaign update. And this was State of the Union. State of the World is coming up next in part 3. And if you want to find out more about me, first off, like and subscribe to this YouTube channel or wherever you are. And then you'll get updates whenever they come out. But also don't forget to go to my website, susan4usa.com. That's Susan the number 4usa.com. And there you can find out more about me and also find out what other platforms I'm on. But if you just go to Google and put my name into Google, you will also be directed to my different various pages. And I've been doing many things over the years. I'm also an artist under the name of Modern Art, so there's that too. And then I also ran for Congress here in West Virginia back in 2022 when I discovered all the fraud in the system of elections. But that's a whole nother thing. So anyways, watch part 1 for information on that. Or watch any of my videos. I have over 800 videos now, so there's a lot to... You can binge watch for a couple of hours, for sure. Okay, so what can I say? I'm going to end here. Thank you for stopping by, and part 3 is coming up. Bye for now.